Is it better to take prednisone every day or get a cortisone shot every 3 months? Which one's better? Which one's worse? I had somebody ask me this in the comments section, so I thought I would make a video about it. Because this is a real good question. Is it better to take a little tiny bit every day or to get a giant amount injected once every quarter? Which is worse? And there's a lot of factors to consider. So I'd like to share those with you and bust a few myths while I'm at it. I'm Dr. Megan, the Prednisone Pharmacist. I'm board certified in the types of conditions people take prednisone for, and I'm a third-generation pharmacist. So what is prednisone? Prednisone is a corticosteroid that is used as a pill in a tablet form, usually. And it's taken in doses anywhere from 1 all the way up to 50 milligram tablet dosage strengths. And the dose that normally people take is somewhere between 10 and 20 milligrams. And this person specifically asked, what if I take just 5 milligrams every day? Matter versus a cortisone shot that is, and that shot is obviously using a needle. Cortisone shot is a really ambiguous term that actually is pretty imprecise. And I was trying to figure out what exactly this person meant by cortisone shot. I've heard that term my whole life, and it seems to be a ubiquitous term. And even ChatGPT wasn't really sure what cortisone shot means. So I'm going to tell you some of the options of what it could mean. Cortisone, there's actually no drug that is injectable that is called cortisone. None of them are actually called cortisone. There's no brand name cortisone, no generic name cortisone. Only like the cream that you buy like over the counter, hydrocortisone, those are actually brand name cortisone. So you can't get that injected into your body because it's a cream. And so there's a little myth busting right there, is there's no such thing as cortisone. Can't get that injected. Then let's talk about shot. Cortisone shot. What does a person mean by a shot? Could it mean a shot into a joint? Or is it a shot into your veins? Or is it a shot into your arm or your butt that's like extended release? And I'm guessing, because they said every 3 months, that it means the butt one, where it's injected into like the gluteus maximus and it's designed to release over 3 months. This could also happen with epidural injection, where you go to the pain doctor and they inject some into your spine. That would be a similar strategy, that it's injected in a place and it slowly releases over 3 months. If it was injected into the veins, that would be quick acting and it would be gone and would not last 3 months. So more differences between the two. If you take prednisone every day, that prednisone pill will kick in within hours, if not minutes, of you taking the pill for most conditions. As opposed to the injection, we're going to just default to the one into your glute, that it's going to take possibly days to inject, but you might get pain relief at the beginning because they often inject an anesthetic like lidocaine with the cortisone injection. So it's normally not just the steroid, it's a steroid with an anesthetic, so it doesn't hurt so much going in. And that one kicks in quick and you get a little bit of relief pretty quickly from the anesthetic, not from the cortisone itself. What about side effects? Prednisone has at least 150 side effects. If you want to know what those are, check out my other videos about this topic. I have hundreds of them. And there are many bad things that can happen when you take prednisone. But are those same bad things going to happen if you are having the steroid injected into your body? According to some belief that I don't agree with, some people think that if it's injected, it's not going to go to the rest of your body. That's called systemic. You're not going to have these awful side effects, except you do. Let me cite some evidence. This comes from a study published in the Annals of Röntgenology. Say that 10 times fast. This is what they said. Locally injected corticosteroid does not remain confined to the joint, and some amount is absorbed by the bloodstream. So if your nurse or whoever is telling you, it's just going to stay right there and it's not going to cause any problems to the rest of your body, that's simply not true. some of it, not all of it, some of it is going other places. So let's find out what these consequences might be. So first, let's talk as if it's being injected into a joint. Let's say the elbow joint, because I saw a really cool picture online of somebody had steroid injected into their elbow. So what might happen there? First, there might be a short-term flare of pain. They're not sure why, but it's possible that the pain might actually get worse before it gets better, maybe for a couple of days. Next, the skin and the tissue around that joint can get thin. The collagen is being broken down by the prednisone, and there can even be a loss of skin pigment. It can turn lighter color than the rest of the skin around it. Next, some of the soft tissue can harden. It's called calcification. Prednisone's causing this damage to all the soft tissue, and calcium is being released and can create these hardened crystals around it. Yikes. In 0.1% of cases, tendon rupture can happen. So those little parts that connect from your muscles to your bone, those are called tendons. They can break, sever, tendon rupture. And that's again from the collagen production being broken down. It's typical sometime between 2 days and 6 weeks after the injection. And so if you're like, oh, doctor, I need more Kenalog, or I need more other pain injection for my joint or for my asthma or whatever, then you'd be like, please let me have more. And they're like, no, you've already had 4. You can never have another one again. You're like, no, I need it. Yeah, there's usually a limit of 3 to 5, depending on the joint, the doctor, whatever they're working on, because you can break your tendons. That is so hard to do otherwise. They're like ropes, right? Okay, so if you were getting a steroid injected into your knee or into your hip or your shoulder or whatever because you have this osteoarthritis, and you're wondering, is a cortisone shot a good idea to help prevent problems? I'm an athlete, I want to get back to the football field or whatever. Won't this keep the inflammation down so I can keep playing and it's going to be better? Not so fast. If you're on the NFL, you better be watching this. Don't let them do this to you. They said you have a faster progression of osteoarthritis with 3.2 times greater odds. That means you have a 3 times greater risk of your osteoarthritis progressing, getting bone on bone. Repeat injections were almost 5 times worse. What about the bone itself? We've talked about all these soft tissues and things. The bone injury is up to 1% of injections can cause bone injury, whether that's osteonecrosis, death of the bone, or just thinning of the bone, like osteoporosis and other complications, fractures. So those are kind of specifically to where you're getting the injection done. Now, what about the rest of your body? What other things could be happening? So there's this myth that it's not going to go to the rest of your body and it's not going to affect you, but that's just not true. Prednisone is part of your adrenal system. That's your stress hormone system, your ability to make cortisol at the proper time to be able to deal with stressful situations. And that system is suppressed. It's not able to do its thing like it normally can for at least a week. It's going to cause a cortisol peak sometime between 2 and 12 hours after the injection, but since it's constantly secreting more of the steroid over time, it kind of continuously pushes it down regulates it, makes it hard for your cortisol system to work properly. They did a study of healthy young athletes who had no reason to get a steroid, just because these would be the most healthy people. And they showed suppression of their adrenal system for 2 weeks after 1 injection. Another study showed that 52% of people who get a cortisone shot or a steroid injection get adrenal suppression. More than half are having this complication. While we're at it, I was going to save this for later, but it also causes delayed complications. In up to 23% of people who get 1 injection, there can still be adrenal suppression 6 months later. And why does that matter? Well, if you are getting this injection because you have something wrong that may need surgery later on. One of the most stressful things you can go through with your body is surgery. And so if you are hoping, oh, I'm going to get a hip replacement surgery, and so until then, I'm just going to get an injection in my hip, that is so stressful on your body. You may not be able to have the cortisol response to be able to deal with that stress. And that can lead to lots of organs failing, that your blood pressure can't respond, your blood sugar can't respond. Everything just kind of starts to stop responding. And that's called adrenal crisis. And it can lead to death in about 5% of cases. 1 in 20. That's pretty high. I would, that's why doctors are like, if you want to schedule a surgery, this much time has to have passed since your last steroid injection. It's simply not safe. Okay, other things that happen. You got the injection in your rear end, but now your face is flushing. What's that about? Well, that often happens in about 40% of people get this flushing. It's more often in women, and it often can last around 3 days. Other side effects include insomnia, because prednisone is the number one drug that causes insomnia, and cortisone shots are pretty darn similar. Headaches, high blood pressure for about a week, high blood sugar. If you have diabetes, they recommend checking your blood glucose at least twice a day for the first 7 days after getting an injection of a corticosteroid because of how high blood sugars can go. There are case reports of people having 500 milligrams per deciliter or higher readings of their blood glucose immediately after. And so you want to stay out of diabetic ketoacidosis, which can be fatal. And make sure you're checking your blood glucose to make sure it's staying safe. Because as I mentioned, it's slowly releasing over time. And we don't want you to have complications of diabetes. Next, psychiatric complications. Confusion, hallucination, depression, anxiety, all of those are possible. They usually happen within a week of the steroid. This is one I'd never heard of when it comes to prednisone, is hiccups. Prolonged hiccups can happen with steroid injections. I'm sure those of you who are experiencing this are not laughing at me smiling about this, but it's something new I'd never seen before. Okay, now this one is kind of counterintuitive to me, at least, is that you can get an allergic reaction to a cortisone shot. 0.3 to 0.5% of people have what's called delayed hypersensitivity reaction. There's usually hives or urticaria near the injection site. And it doesn't usually happen immediately, but several hours or days later it can happen. And the reason that's surprising to me is because prednisone is often used to treat allergies and urticaria. And so for me, I wonder if it's something else in the injection itself, whether it's another ingredient in that injection that's actually causing the urticaria. I don't know. Maybe there's somebody who knows this better than me, but it's just confusing when the drug is used to treat this and people are actually having that reaction. Okay, now let's talk about the eyes. Retinal detachment. That means like your eye kind of breaks. You're blind. That's bad. That can happen. Glaucoma. That's really high pressure in your eyeball. Can also lead to blindness. Bad. Both of those are less common, but can happen. And then other things that can happen that are more delayed include osteoporosis. Even if there's an injection in the spine, there can be a decrease in bone density in the femur. That's the top of your long bone of your leg. So like the injection's not right at your leg. The injection's on your spine, right? Like 2 different locations. But the bone loss can be found on the femur itself. And then if you're a woman like me, these shots can do weird things to your periods. In about half of women will experience a delayed period. So, in my opinion, which is better? Prednisone 5 milligrams every day or a cortisone shot? I think it really matters what you're using it for. Because I was using it for a life-threatening blood disease called ITP. And in that case, a cortisone shot would have been completely inappropriate. As opposed to someone who's using it for pain, like joint pain, I think an injection is a great idea if it's short term and you're going to have other alternatives later on, as opposed to taking the pill. No reason to like have side effects all over your whole body as much if you can just target the little places for a short-term pain issue. And then I want to conclude with a story. So a family member of mine, way back in the day before there were great medications for allergies, was allergic, had got the worst seasonal allergies, would have a really hard time breathing, just a mess, have a hard time doing the job. And he got an injection of cortisone. That's what they said, probably Kenalog, every couple of months during allergy season. And then the doctor said, no, you can't have any more. And he said, no, doc, you don't understand. I have to have this or I can't breathe. I'm not sure, but maybe this family member also had asthma in addition to the allergies. No matter what, the Kenalog shot was a great Band-Aid to get him through that tough time, not being able to breathe and with the allergy season at its peak. But it was not a good long-term solution. I'm really grateful that nowadays there are allergy pills, nasal sprays, inhalers, lots better ways to get the drug to the place where it needs to be. Eye drops, like getting it as targeted as possible is the best strategy. And so if you're like this family member and you're like, should I get a Kenalog shot to treat my seasonal allergies? I would say, heck no. We have so many better options and like you won't be able to use it later on. Like you're limited to how many times you can use it. So like realize that when you're using steroids of any kind, you are making a deal with the devil and you do not want to make that deal when it's not completely in your favor. Like it's got to be so awful in order to want an injection like this, in my opinion. Thing is, like you can go off a prednisone pill of 5 milligrams really fast. If you're having these psychotic hallucinations and it's stuck in your body for 3 months, holy cow, that's going to destroy your life. Like months of psychosis. As opposed to prednisone, you literally just stop taking it. Don't take it the next day. I personally would not want to make that gamble with my health. Nope. So, in my opinion, is it better to take 5 milligrams of prednisone every day? Yes. Than a cortisone shot every 3 months. Definitely. But like I said, it really depends on what you're using it for. There's a few situations where a cortisone shot may make sense. And that's really a discussion you should have with your doctor. And if you want to know how to deal with the side effects of prednisone every day, I have a prednisone checklist you should check out. It includes the things you can do to minimize the side effects while taking prednisone. I personally had to take it and it was a horrible experience. So I recommend that you take all of the precautions you need to take to make sure it's as good of an experience while taking prednisone as possible. Just click the link below to download this free PDF now. Signing off as Dr. Megan, your prednisone pharmacist.